Kia ora. Welcome to our webinar on fighting racial justice in healthcare, which is part of Te Tiriti Based Futures 2024. It's lovely that you could all join us. I'd just like to open with a blessing from Arundhati Roy, who's an Indian feminist. To never get used to the unspeakable violence and the vulgar disparity of life around you. To seek joy in the saddest places, to pursue beauty in its lair, to never oversimplify what is complicated or complicate what is simple. To respect strength, never power, above all to watch, to try and understand, to never look away, and never, never to forget. So we've got this, those of you that are frequent flyers here at Te Tiriti Based Future will need no reminding of our community code, but if anyone is new, this is a place, this is a learning environment. We're here to be curious, open and respectful. We're here to make generous assumptions. We're here to speak from our own experience and to not take ourselves too seriously. So let's have fun learning together. And this is the instructions for anyone that needs closed captioning. Thanks to the people working on that. So today we've got with us Tony Shepherd, Rawiri Jansen and Jean Tahuya. It's very exciting. Now, what these people have in common, I did a little reflection on these characters. They are all relentless, passionate, staunch, articulate advocates for Māori health. And at this time, we've never needed relentless, passionate, staunch, articulate advocates for Māori health any more than we do now. I'd just like to invite the crew to tell us a little bit more about themselves in the opening round. Let's not start with Jean because she appears to have done a runner. Tony, do you want to step up?
Sure. Tēnā koutou ngā iwi ngā haui whā, he whakatau kia koutou katoa I tēnei ata. Ko wai tēnei e mihi atu ana, ko auraki tuku maunga, ko waitaki tuku awa, ko tāhu pōtiki te tūpuna, ko takitimu rawe ko urao o ko waka, ko kaitahu rātou ko Pāti Māmoe, waitaha o ko iwi, ko Ngāti Mōki tuku marae, ko Ngāi hiki hiki tuku hapu, ko Ashby tuku whānau, ko Tony Shepherd taku ingoa. Kia ora, morena, morena. It's great to be here today on a rainy day in Tāmaki, beautiful day. My name is Tony Shepherd. First and foremost, I'm a mama of 4 gorgeous tamariki who are my ao. I guess I consider myself a scholar, an activist, an environmentalist, and a clinician who's really devoted to protecting the integrity of whakapapa. I love Heather's words, relentless, passionate and staunch. I'll take those, thank you. And I lead Tama Āri Ki Ora, the Starship Māori Health Team, and I think I'm here because we are embedded in the daily fight for child health equity, social and racial justice. And my kaupapa and mission within all of that is to ensure that we are continuing to move towards a more puna-centric, whānau-focused and whānau-led child health system. Yeah, I'm looking forward to the kōrero with my koa Rawiri and Jean and yourself, Heather, today, and seeing where we go. Nō reira, tēnā koutou.
Beautiful, Tony, and I just want to be absolutely clear that none of the speakers today are speaking on behalf of the Crown or in any official capacity. It's a Saturday and they're in their own time speaking from their own perspective. So just to be perfectly clear, this is not an official position, this is people on their bloody days off. Kia ora, Rawiri.
Hey, kia ora tātou. Tēnei au he uri no Ngāti Hinerangi Ngāti Raukawa. Mahi nei au hei rata hāpori I te wharehauora Rangaiti. So I'm working as a rural GP part-time, trying to decolonise the primary healthcare system in Matamata. And so I really enjoy being provoked to be relentless. I think relentless is certainly a feature that we've got to be mindful of right now in the current circumstances, that our kaupapa is enduring, and so there's lots of challenges, and it calls on us to all be dedicated to better health outcomes for our people. And so big mihi to your team that set up this, and it's been going all week, and you've had crowds of people into the different sessions. But yeah, welcome to everybody this Saturday morning. And my other day job is Chief Medical Officer, and probably not for long, because the disestablishment's underway. So kia ora tātou.
Kia ora, Rawiri. Jean.
Kia ora. Ngā mihi nui koutou katoa mō tēnei ata. Ko ai, ko Ngāti Kahanunu rawa ko rangitāni taku iwi, ko te whatu āpiti rawa ko Hiniti mō te marae, ko te opura te huia taku hoa rangatira, ko Jean te huia ahau. I'm a midwife. I've been a nurse for 50 years. It shows my age. I trained at the Hastings Hospital when I was 16, 17, and I went and became a freezing worker for many years. And then when it became redundant, I went back and did my nursing again to be a midwife. So now I've been a midwife now for 32 years, and we're birthing our 4th and 5th generation of children and babies from the same whānau. I'm here in Ngāti Kahanunu, the sunny Ngāti Kahanunu in Hastings or Hawke's Bay, and I'm very privileged. I work alongside 5 Māori midwives and 4 RNs. We run clinics, free, open access, nurse-led clinics in Hastings, Flaxmere, Central Hawke's Bay, a mobile clinic service. And my passion is for Māori women and children, and I'm passionate about them having the right care. I'm passionate about our workforce development for Māori nurses and midwives, and I don't see our world being in any way supported. And so I always speak out when I see opportunities for people to become more enlightened about our world. And what really gets me going is when somebody from another world comes into our world and tries to tell us what it needs and where the solutions are. And I get really, really quite verbal about that. So and I'm really looking forward to today, because there's some awesome people here on this group, Rawiri and Tony and Heather, and I feel very privileged to be amongst you. Thank you for the invite. Kia ora.
Oh, kia ora, Jean. Which reminds me, I forgot to introduce myself, which is particularly amusing. I'm Heather Kame, he tangata tiriti ahau. I'm an activist scholar at large, a founding member of STIR, and on the core group that has been running these events since 2020. Lots of other people are trying to set the Māori health agenda at the moment. So I thought we'd start with Māori health priorities from the Māori health leaders, because that seemed smart. So if anyone wants to chip in, what are some of your top priorities about Māori health? What do we need to be focusing on?
I'd like to just chip in here. One thing that for me is quite I believe that we don't want to be the same. You listen to Stan Walker, his Origin song. We don't want to be the same, because we have different needs, we have different wants, we have different ways of doing things. And that can only come about when we, as Māori, determine what that is and what that solution should look like. That can't come from anybody else. And as long as the Crown continues to interfere and put resources that are wasted and trying to develop and improve what is basically our needs, I think that we're going to continue to have disparities and equities, and I would really love it if they would just step back and just give us the resources to get on with it, really. So I'm sad that the Independent Māori Health Authority is being disbanded. However, I did hear Shane Reti talk about the fact that they're now looking to give more resources and to make more equitable decisions. So I'm going to be watching this space. Kia ora.
So, Jean, do you think that it might invest more than the 1.91% in Vote Health into Māori health providers coming up?
Well, I believe that under the Independent Māori Health Authority, we were getting 3.2% of the funding. So, you know, when you think about it, we might get more. So, you know, I'm glad that we're no longer only going to be getting 3% of the funding. So let's hope there's some better stuff on the horizon for us.
Kia ora. So, Tony, what's on top? What if you're...
Couple of things. The first one, I think, the greatest investment in health is our tamariki mokopuna. And what we struggle with is child health equity within our health system as a whole. And as our population is naturally aging, the demand for health services is increasing. But what gets overlooked in that scenario is the disproportionate influence wielded by adults in shaping health policy, all the resource allocations. I think health leaders, policymakers, stakeholders are really swayed by the voices and needs of adults who are better able to advocate for their own interests. And this, of course, leaves children, our tamariki mokopuna, and particularly Māori children, at a really significant disadvantage. And obviously, probably preaching to the converted, but neglecting the health and well-being of our tamariki mokopuna not only perpetuates existing inequities within the system, but it really undermines the long-term health and prosperity of our society as a whole. So, you know, just a little example about this particular kōrero is that when they were drafting the pai ora legislation, we made a submission and which went to select committee, and we went and had an oral submission opportunity, and we said at that pai ora meeting to those officials, tamariki mokopuna are not mentioned at all within this legislation. That is an incredible oversight, and I think is reflective of how the health system works. So child health equity within the health system would be my first thing. And the second thing along the same lines would be to create a true ministry for children, built on the health and well-being of our tamariki mokopuna, the human rights of our tamariki mokopuna, the needs, including the voices of our tamariki mokopuna. Because currently in Aotearoa, we have oranga tamariki who, by their own admission, look and own words, look to the risk of significant harm now or in the future, kumatu. And our tamariki mokopuna deserves so much more than this. And you know, I'll talk a little bit later about the colonial agenda, but I think, you know, our tamariki mokopuna don't have voting rights. They're seen and not heard. And a ministry for children could go a really long way in investing in the future of our country. And I think Whina Cooper, and hopefully I don't kind of butcher her words too much, but she said, take care of our children, take care of what they see, take care of what they hear, and take care of what they feel. For how the children grow, so will be the shape of Aotearoa. So best investment, Māori health priorities, mokopuna and tamariki.
Kia ora. And so you'd be supporting the young people getting the vote then, Tony?
I'm a strong, and what did you say? Staunch and relentless supporter of that, absolutely.
Kia ora.
I think we often get pakaki and matua to speak on behalf of our tamariki mokopuna, and we really need to be hearing their voices to know how to progress Māori health in this country.
Excellent. Rawiri, I'm sure you've got a chip in.
Yeah, easy to agree with Jean and Tony, so I love that. And then you did this nice segue into the sort of intersectoral space. But I wanted to start with a really positive message that, You know, we should be really optimistic. We're 1 million people now. You know, Stats New Zealand will take the rest of the year to come out with the truth. But the truth is we're 1 million people. I might have to include Gold Coast in that to get there. But, you know, we're over 970,000 people, whatever. We're a nation of 1 million people. We're entitled to have a health system that works for us. And so lots of this will be true, right? 30% of all births in this country this year, last year, next year are Māori births. So that's a lot of hapu mama, and we want to start with that. I absolutely agree with best start. It's got to be about, you know, hapu mama and our pepe and our tamariki. So those are beautiful kōrero, and I endorse those. And equally, there'll be a whole lot of things in our health system where we can go, we can fix this. And so Jean's right. If we get the resource, the Māori Nation will fix a whole lot of those things. Think about lung cancer. We will set up a Māori lung cancer screening program. And that's really important contribution to our health inequities. And then let's lift it up out of just the health system. If we want health outcomes for our people, we have to engage across the system. We have to be thinking about voting and voting age. We have to be thinking about the justice system. We have to be thinking about corrections and policing and the racism that's in our society. We have to address all of those things. You know, housing, the economic fortunes of our people in terms of employment and training and so on. So all of those things, we have to be active across all of that. So we individually can't do it. We have to collectively do it. We have to reach out and build our alliances and our collective impact by working together. So, you know, the future will be tiriti based, and we've got a struggle on our hands right now to, you know, stay organised and stay impactful. So that's what I'm thinking about, top of mind. Over.
Kia ora, kia ora. Well, I hope that everyone here at our gathering is committed to a treaty-based future. And the good news is there's over 4,500 people that have been passing through over the last few days. So there's a few characters in the mix hoping to step up. So we obviously have an elephant in the room at the moment with the current government. How's it looking from your perspectives in terms of the threat and challenge for Māori health?
I believe that unless we look at historical injustices, we're never going to go forward. And as long as we're denied the truth, then we can't then build what needs to be done, because we continue to be stuck. And I get really frustrated when I keep hearing people say to me, oh, why don't you guys just get over it? This is non-Māori people. You Māori just need to get on with it. Well, actually, every day we walk past land that used to belong to our forebears. Every day we have family living in caravans and tents, no longer able to build on their own land. And so we have these historical injustices that are never seen and heard. And also I think there are inadequate allowances to adjust to those historical injustices. And I think going forward, once that has been revealed in its truth, I think that gives us an opportunity to then look at that and move on. Because until we get that, we can't move on. We're stuck. That's how I see it. Kia ora.
Kia ora. So the everyday impact and legacy of colonisation and the embedding of institutional racism through our public sector.
Absolutely. Every day. Look, we're birthing mums with 4 kids living in the back shed of a house and whose whānau owns land, but they can't build on it because there's a Resource Management Act that prevents them from building on their own land. When Rawiri talks about health being more than just health and medicines, he is talking about housing. He's talking about the social needs of our whānau. It's more than just health. It's housing and education, and it's developing, it's feeling worthy, having an identity. And, you know, I'm going to throw in the Maori Land Court in that too. How often our whānau sitting on huge blocks of land that they can't use. We have a system whereby it takes 25 to 30 years to be heard, to get succession plans going, successions for your grandparents, and the children are still waiting for those so they can move on and do things on their own land. I mean, at every stop we've got these barriers, not just in a Pākehā system, but also in our what's supposed to be our Māori system. So it's all of that embedded in these in rhetoric. And so, you know, I see it every day. I go, well, why don't you fellas get out of that tent and go home? You know where your land is. And they go, oh, but we can't, we're not allowed to go on there. We can't build anything on there. You know, that's crazy, crazy, crazy stuff.
So there's not a lot of trust in Māori solutions, hey, Jean?
Yeah, well, you know, this is where the Pākehā needs to understand when they go, oh, yeah, but you Maoris get this and you Maoris get that. Well, actually, no, we don't get that. We don't get, you know, and even if we do, it's tied up in these beautiful little bows that's knotted that nobody can unpeel to get at the resources. And, you know, we sit back and it just, we wait and wait and wait and wait. Māori must be the most patient Indigenous people in the whole of the planet. We've been waiting for 255 years. You know, we're so patient.
Clearly, Jean. What's your perspective on the elephant in the room, Tony?
I just want to echo really what Jean has said. I think that the elephant in the room is the colonial agenda. I think just my cordial back to you, Jean, was that about the interconnection of everything, that land alienation has had long-lasting effects on Māori health. And actually, in 1880, they could reflect back in the data that in any given region that land loss happened, there was a marked increase in child mortality and mama mortality rates. So that's still continuing and it's outrageous. I think that racism is so universal in this country, so widespread, so deep-seated, that it's almost invisible because it's so normalised. I think about, I think it was back in the 1850s where physician and politician Isaac Featherston, he articulated this notion that the Europeans' duty was to smooth down the pillow of the dying Māori race. And I think really shamefully, this ideology still persists today, right through all our systems, as Vauri's saying, justice, health, housing, and it can be, I guess, visualised as the continued smoothing down, from my perspective, of our pillow by the Crown and Pākehā. And I am just so proud about, as Māori, we are relentless, we are passionate, we are staunch, we are taking our tangata tiriti with us on this journey. And I think the last point is really about, I think, one of the most insidious manifestations of this ongoing colonial agenda is the neglect, negation, or outright ignorance around the health of our Māori mama and our Māori tamariki mokopuna. Colonisation at its heart was and is a mechanism to target the hopes and aspirations embodied in our mokopuna mo a pōpō, our mokopuna of the future, our future generations. And I think that's really the elephant in the room. We look at our data and we go, okay, rheumatic fever, Māori children 40 times more likely to be hospitalised. If you've got a respiratory condition and you're Māori, you're twice as more likely to be hospitalised. You know, more than half the children that come into our hospital with major trauma are Māori. More comorbidities, higher mortality. That is the colonial agenda, and they highlight really the need for urgent and meaningful systemic change.
Kia ora. So it's interesting about the colonial agenda because it's as if it's gone and had a look at the evidence and then done the opposite. How can we do the most harm? Quickly, let's move the deck, yes.
Is it really having a deep dive? They have you know, 2% of the health budget, you know, for, you know, child health equity or Māori health equity. Really? Is that really taking a look?
We need some big numbers, don't we? We need some better numbers than that. Rawiri, what does the elephant look like from your angle?
So I think we're facing some really tough times. And so the colonial agenda is advancing, and so I don't think it's doing the opposite of the evidence. I think it's acting in its own interest, and it wants to advance that right now in very specific ways. And we're at risk. So we're at risk of becoming unemployed in these times. We're at risk of this housing crisis getting worse. Yes, our jobs and our houses and our incomes are, I think, in peril. And so we have to act. We have to resist that. We have to organise to support each other in our whānau and our communities as we go through that. My wife's a midwife, and she would often say, when you know these are really tough situations, the only way is through. We have to push through. We have to be organised, and we have to be relentless. And that is our immediate future. The longer term future, I think, is bright, and we should be optimistic. There's lots of things for us to be celebrating in our future. Right now, we've got some work to do. I think that's, there's no elephant in it. This is our current state of the relationships in Aotearoa. And so whānau, out there, everybody, let's get organised, let's get busy, let's support each other, and let's get through this.
Kia ora. So it's interesting from a public health perspective. If they're acting in their own interest, how is it in anybody's interest to widen inequalities, which we know drops health status? Hey.
I think that what we've got today is a legacy where there is more profit in it for the Crown for us to be dysfunctional, starving and totally inadequately able to care for ourselves than there is in making meaningful changes to our lives. I mean, we're looking at multi-million-dollar industries, which is built on the dysfunction of our Māori whānau. And so I think to turn that around, we need to be given the assets and the resources to be able to turn that round for ourselves, to shape what that looks like. I agree with Rawiri. I think we have got hope. I was listening to the news the other day when they're going, devastation, devastation. We need to bring in more immigrants because our birth numbers are down. But actually, when you looked at the birth numbers, Māori birth rates have gone up 30%. And I go, awesome, that's cool. The only birth rates going down are for European Pākehā women. And so we have got opportunities now to say, well, awesome, look at the new birth rate, look at who are being born in this country, and we need to make it better for them. And one of the biggest problems, I believe, is food. We're no longer able to grow and eat and source our own food. We've got millions and millions of land being put in trees for carbon credits when we should be growing fruits and vegetables and putting stock, and most of that's Māori land. So while our Māori trustees are putting our Māori land in trees, and I'm thinking, for Christ's sakes, you can't eat a bloody tree. We need to be putting it in food, and we need to be feeding our people. Last week, the Flaxmere supermarket closed down. 12,000 people in Flaxmere now don't have a supermarket. So the cost of food is huge for them. They've now got to come to town, to Hastings, to buy what is now essentially food brought in from overseas. The prices are out the bloody roof. That's all of that. Sorry to go on. Sorry.
Well, food is kind of fundamental to hauora, is it not?
Yeah.
So we've got like, Jean, you're telling the kōrero about Māori are distinct and different, and we need Māori solutions.
Yep.
That are culturally relevant.
Yep.
Jean, you're saying the young ones. Yep. Listen to the young ones. We've got to sort that out because it creates all sorts of things in action in that space. And Rawiri, you're talking about the need for kotahitanga and to work across systems to address racism and to be hopeful because demographics are on the side of Māori.
Mm.
So if we're gonna how do we move those agendas forward? Because those aren't the sorts of things we're hearing from the government in relation to health, is it? Well, it has been what we've been hearing from Te Ako Whaiora, but going forward, like how do we?
I think we need to keep lobbying for change. I think we need to advocate for our rights as Māori under Te Reti o Waitangi. We need to honour the treaty. We need to honour Indigenous rights, and we certainly need to honour human rights. I think there's an appalling history in this country where the human rights of women are abused on a daily basis. When somebody, for instance, can walk into your hospital delivery suite and take a two-hour-old baby off them and nobody knows they're coming, that's a huge breach of human rights. And most people think, oh God, that's not happening, but it is happening. It happens every day. And so I think there is a huge opportunity to look at what does Te Reti actually mean? What does human rights mean? What do Indigenous rights mean in this country? And how do we right the wrongs that have happened and continue to happen every day?
Is there specific things that would be useful for Tauiwi and Tangata Treaty to pick up in relation to supporting this kaupapa? Because
Yes.
I feel like it's...
Yeah. Go Dawidi.
Well, there's millions of us, so
Absolutely.
surely we can chip in. Is there something we can do usefully?
Well,
Other than...
but the problem I've got with your question is it sounds singular. There's one thing to do, and let's hear your question slightly different. Are there some things that Tauiwi should do? Yes, hell yes. And so let's imagine that there's a very long list.
Okay,
and that
let's
everybody
make the
wants
list.
to kind of, yeah, so it will be in terms of addressing specifics with rights in that space of haputanga and, you know, that Jean is bringing to us. It's really distressing. It's really important that our whānau are not exposed to that, because that will create intergenerational trauma. That shit that's been going on for a while, we have to intervene and stop that. And so, you know, Tauiwi who can join that particular struggle, absolutely get involved, because that's important work. Equally, there will be work in terms of cancer, whether that's lung cancer screening, or how do we make decisions about which cancer programs and how we organise them. In local places, there will be programs of action around addressing acute rheumatic fever. There will be programs of action about access to healthy foods and school lunches. There will be important work to do in terms of transport, public transport, or, you know, changing our transport industry to be more, you know, environmentally safe, etc., etc. There's a very long list, and I think that's important that we stay joined up in that we support people, you know, picking up those parts of it that they can. It's mā tātou katoa tēnei whawhai, e hara mā te kotahi, mā te katoa.
Yeah, and I've got a lot of responses, trying to order them a little bit, but I guess I have a few things, and one is that I don't need you to be Māori. As you can see from the speakers today, we've totally got that covered. I just need you to be a good Te Tiriti partner, actually. And kind of, I'm just thinking about the burden of mahi and cultural loading. Also, as tangata tiriti, you need to do the work to figure out your own responsibilities. I've got some starters that I can start you with, but, you know, they're pretty basic. Know the history of this country and the process of colonisation. And the process of colonisation that brought you here to this whenua, and the privilege you have because of it. There's loads of articles, stuff on the internet about that. The second thing I'd say is don't make things about your hurt feelings or your fragility or being excluded from Māori spaces. Just really understand that. I think another thing is recognising that racism, like most systems, isn't about bad people who do terrible things to people that are different to them, but instead it's a way of maintaining power for certain groups at the expense of others. So you need to be prepared to sacrifice to address the power imbalance. And we find that all the time is that actually people are good at talking the talk, but they don't when we come down to the financial or sacrifice that's needed to be made. there's kind of a stepping away from. I think I love what Rawiri's saying about, you know, kotahitanga, standing with us when we protest for our rights and our right to exist in this whenua. I think about the anti-racist word. I think about the beauty of anti-racism is that you don't have to pretend to be free of racism. You can, anti-racism from my mind is a real commitment to fight racism wherever you find it, including within yourself. And as far as I can see, that's the only way forward together. Yeah, I think they're my kind of scrambled thoughts, but yeah, some thoughts for people.
Oh, it's a beautiful contrast, Tony. I love that Rawiri's clearly got the long list, and if we push the button, I think he could speak for the rest of the day on the long list that's ready to go about what needs to happen. And I love that vision. And here we've got Tony going, well, hold, tai-ho, sort out your own stuff, you Pākehā people, get your house in order and step up. Now I'm waiting in anticipation. Jean, what have you got?
Well, I think that we have opportunities to look at the workforce, because we don't have a Māori workforce. And, you know, possibly we don't, you know, I keep hearing about, oh, we need to teach Pākehā to be more recipient to Māori needs. Well, actually, if we had our own workforce, we wouldn't need to do that, because we'd have enough of ourselves to do the work for ourselves. However, we've now got a system where only the rich can afford to be health workforce and to join the health workforce. We need there's now a 4-year midwifery degree. And, you know, most midwives, student midwives are mums and mothers with children. How the hell do you afford to go into university for 4 years if you want to be a midwife? I believe we need to bring back hospital-based training so we can get a community of health workforce that are connected to the community, and that we need to be able to review and re-look at what's not working. It's no use continuing to pour millions of dollars into things that don't work, when actually we know what we know works for us. Why can't we have a go at doing that? Why can't we have Māori hospitals around the country that are funded by Māori for Māori, and we develop our own workforce? You know, simple as that. There's so much opportunity right now, and we, as Rawiri said, I'm really loving the fact that there's 1 million of us. Imagine when there's 2 million of us. You know, we have got that opportunity, and we haven't laid down and died as they thought we would do in the 1800s. Actually, we've come back with a vengeance. You look around, I walk down Kmart and all the Māori women with the mukukawai, and the beautiful resilience in our Māori women, our Māori tamariki doing the kapahaka. Look at Pacific in Auckland right now, we've got the kapahaka going. Everybody's just loving it, because that's who we are. That's what we do. That's what will save us, our culture, our connection with our communities and our families, our whānau. And, you know, for me, that is where the answer lies, in our workforce, having an appropriate workforce that we create for ourselves. Yeah.
So you've gone back to your opening comments in a circle, which is excellent, to reaffirm Māori leadership.
Yep.
And Māori workforce.
Yep.
Which takes me back to Rawiri's comments about it's about the whole system, because it's the tertiary education system that has been failing to produce Māori graduates, because if we get folk to the door, they don't necessarily survive the what happens at the university system. Has anyone got any comments on a tertiary education system in relation to this? Because the health system doesn't stand alone, it's in context A.
Yeah, so acknowledge that. And so we've got some real significant issues in terms of access to tertiary education. And once our people get into the tertiary education, we want them to thrive and, you know, come out with great qualifications and then make great contributions for our community. Also, let's notice, actually, we've made some really great progress in that space. And we've got more Māori doctors now than ever before. We've got, you know, 20% of those going into med school are Māori, and 20% of those coming out the end of med school are Māori. Some really great work there. We've got more Māori nurses in training than ever before. Midwifery. So the midwifery workforce is 12% Māori. And my midwifery Māori mates will go, that's not enough. You know, come on, we've got work to do. So I acknowledge that they're out the front and they've done a really great job to get there, and it's still not enough. More to do. Keep going. And so I love that saying there that, you know, we're not going to roll over and die. Kaua e mate wheke, me mate ururoa. Let's absolutely give everything to this. Do not give up. You know, lots to do. And I love the education. Push the education button, people. That's the, you know, really significant thing for our young people, to get through an education system in which they thrive and they come out and they do really amazing careers, whether that's in health or in any other career. Great. You know, we've got to get our kids really achieving incredible things through the education system. Over.
Anyone else got a chip in on that particular kaupapa?
I think my critique of the education system is the same as the health system, really. And I think, you know, my interest is in how do we inspire our tamariki mokopuna to be engaged in a system of education. How is it that we can inspire our mokopuna tamariki to pursue whatever career they want to, whether that's health or anything else? And how do we support them, as Jean was saying, how do we support them in a pragmatic way, given the social determinants that are in our society at the moment? You know, poverty, you know, how many Māori dropped out of university during COVID, or, you know, in terms of education, didn't make it into certain courses. You know, we're cutting off our nose to spite our face as far as I'm concerned. But my interest is really, how do we strengthen our pathways for our young people into wherever they need to be?
Kia ora, because you've raised a few health professionals, haven't you, Tony?
I have raised a few health professionals, and we've just had a launch actually on the 28th of February of Ringa Atawhai, which is literally a hand of support, and it's a culturally responsive multidisciplinary team, and we can bring our young ones up in this kohanga with other kind of Māori and tangata tiriti to be engaged in the health workforce, so they can have culturally appropriate supervision, they can be supported to grow, and we're pretty excited about that in terms of our child health workforce. We're talking quite a lot about what we can offer other communities around the motu. So for us, this is not just about our rohi, this is about raising the capability and capacity across the motu for people to kind of engage with our tamariki mokopuna. And that's pretty exciting as well. So, you know, I don't think, you know, with Rawiri and Jean was short of ideas. We just need the system now to provide us with some resources so we can go away and do what needs to be done. And if I was talking to Shane Viti, just at this moment, I would say
he's down to watch this
Rawiri
webinar.
gets his job, to keep his job, reinstate Te Aka Whai Ora, give them 50% of the health budget and more than 180 years to get it right. So that would be what I would say to him.
Kia ora. What would you say, Jean?
Well, there's so much opportunity right now, and I think that I would be asking him to relook at their budgets and what are they actually spending all that health money on, and priority is Māori health, because if we did it just on need and inequity, then they cannot justify just giving us 3% of the budget. They have to go back and be realistic about what that looks like. You know, across the board, from te kōpū, from the womb to the grave, for Māori, it's the whole gambit. And so, yeah, I'd be asking him to review what they've got first, and then say, okay, what does that mean for us? You know, start from them.
Well, it's an interesting and clear measure, isn't it? If we're trying to increase investment in Māori health, we'll be able to easily measure that. Rawiri, obviously you're in a complicated spot, but you're a private citizen in this moment. What might you say as a private citizen if you were talking up?
I'm going to deflect and say something different. Like today and over this week, you've brought together a kind of collective of people who are interested in tiriti-based futures. And I guess we might collectively ask, what is it we're looking for in a Minister of Health? And we're looking for a number of characteristics. And Shane might or might not have those specifically, but let's just be really strategic about what we're looking for. So we want a Ministry of Health that addresses the inequities relentlessly, because that's a kind of feature of us being in this space. We're prepared to stay for the long run to get better outcomes for our people. And so that will be in a number of ways in how we organise a health system and how we fund a health system and how a health system intersects with other parts of the system, because we still want to be able to talk about corrections and policing and housing, education and employment. We want a Minister of Health who can have those conversations with, you know, the rest of their government. But we also want a health system that starts to be anti-racist. And I think we've got some beginnings of that. And we've got a lot of allies in the health system who want to be part of an anti-racist health system. We've got allies in the system who want to be a part of a pro-equity health system. And that work carries on. But we want a Minister of Health who, you know, supports that and acknowledges that, and sometimes creates the right arrangements or the levers or the policies or the regulations that helps that become a reality. And then, so anyway, I just think we should be really clear about all of those characteristics that we want in a Minister of Health, and then collectively we should be relentless about going forward into the future, organised, you know, looking for these kind of aspects in our future across the whole system.
So it sounds like we need to write a position description.
Can I
Which
just
would
say,
be quite fun, wouldn't it, to write a position description and then put it out publicly, and then it's time to do some monitoring. Let's get the calculators out. Let's make friends with the health economists, and let's monitor the hell out of the situation. What have you got? I can see you bursting there.
Sorry, I was just going to say, as long as we don't deregulate everything and make it all privatisation, because then what will happen is we get the big businessmen coming in with the big bucks, and then only the rich can afford to be part of the health system. So we can't allow the government to offset the cost by giving it and deregulating it and giving it to somebody else to do. I think the government has a responsibility to remain as responsible for the health of Māori and not give that up, because then I think we risk having a bigger loss, because then it will be profit driven and not equity based driven. So there should be a message in that as well.
Oh, kia ora.
Yeah, I'll go with that too, Heather. That reminds me, so right now there's something like 275,000 New Zealanders who are not able to be enrolled in a primary health organisation. There's a similar number, something like that, 275,000 New Zealanders who have a debt at their primary care provider. Imagine what barrier that creates to going to see, you know, your nurse or your nurse practitioner or your GP in your primary care clinic. You've got a debt at the front door. Those are major problems. So we should be in coalition with everybody, because New Zealand is better off if we have a health system that doesn't have those features, where everybody can be enrolled, where everybody can be served, where people don't have a debt at the front door. We're all better off as a nation. We're specifically better off for Māori if we can address those. But, you know, there's work to do in our current settings.
Yeah, and I just want to, I agree with the kōrero, and I just, as you've been speaking, thinking about the end game for us, and I want to remind ourselves that actually it's not equity, that's the starting line for Māori, is equity, and we want to be aspirational and address more than the inequities. We want to be including mātauranga Māori kind of ways of being within all of our systems. And the other thought I had while Rawiri was speaking actually was around accountability. So in terms of writing a position description and the kōrero about resigning from UNDRIP, the United Nations Declaration for the Rights of Indigenous People, stepping back out of UNCROC, which are about the rights of the child. we need to continue as Māori, as tangata whenua, to advance the puapua, which really does talk about disrupting our political, our justice kind of norms, and providing a kind of pathway forward. And I think that those accountabilities as tangata whenua, that's our responsibility to keep relentlessly and passionately and staunchly, raising that in every forum that we're in.
Kia ora. Tony's setting the wero, the challenge there. And if it's good enough for Tony to do that, I'm picking it's good enough for the rest of us, team. The benchmark has been clarified. Now we've got a complicated question. Good old Rawiri's just sorting out the questions in the chat, which in the special Q&A, which I think is excellent. And that kind of workload, you know, I do think, Rawiri, I look forward to a day when you are the Minister of Health or the boss man of the health sector, and I think you'll be top notch at that. So I'm just making a suggestion. If you know, at some point in the future and you're twiddling your thumbs, I think that would be an excellent choice. Are other people with me? Should we send some emojis to Rawiri at this time?
But I want to ask a question. What party would you stand for? You know.
No,
The
exactly.
job, yeah, you two could do it together. See, look at that. I think there's strong support for that idea, Rawiri.
The chat's really interesting. There's a lot of love coming through in the emojis, and that's a great thing. And there are people who kind of, they want to make statements, they want to step forward and they want to be seen and they want to organise and they want to join up. And that's, I think, a real credit to the space that we're in. We've got this really interesting, complex situation in front of us, and the only way is through. So coming together, and this webinar is a good example of it. It's really important that we stay together and we stay positive. We got work to do, but we can get this done.
All right. And I see that Young Forest Fire is just suggesting that if people have got time on their hands, they can join the Radical Sewing Circle, which is a nationwide network who have been working on some items. And earlier we saw a note in there from Joy Ratama talking about the Te Aka Whaiora Solidarity Day with Te Aka Whaiora and the Māori Health colleagues on the 28th of March, where there's people nationwide going to be baking and dropping the baking off in solidarity with our mates who have been having a little bit of a battering. So that's beautiful. But just because I've got my Stir t-shirt on, we're going to be continuing. We've got our petition going about protecting Te Aka Whaiora. That's, last time I looked, it was on 17,000. I'd be much happier if it was 25,000. So if we can get some more names on that petition, I think that helps with the lawyers that are in the Waitangi Tribunal fighting the good fight at this time, because we want to be in the strongest possible position. If we've lost Te Aka Whaiora and that's unwinnable, let's get something as strong, if not stronger. You know, because if we lost one battle, let's win the war by keeping on going and trying to get the strongest Māori-led entity and the biggest investment we can in Māori health. And we'll be forming, we're working on getting some coordination and some coalitions of public health related folk who want to work on Rawiri's long list and Tony's shorter list, and Jean's just, you know, get out of the way so that Māori can lead. But we've still got a quality 6 minutes, and I think that Rawiri's dealt with all of our questions in the chat, which is top notch. So we've still got, yeah, what else do you want to say to the peeps out there? Because it's the people that are in the room, and then there's the hundreds of people that will watch this after today because they're out doing sports and other public health activities today with their families. What else do you want to say to peeps? It's like an open mic, isn't it?
I'd like to say that health starts at home. I'd like to say to all those young mums that want to make changes in their lives, to take that responsibility, to be the best mum that they can, to look at themselves and say, do I really need to keep smoking dope? Do I still need to be with the useless partner that I'm with? Can I make my family stronger? And, you know, we know that it starts with yourself at home. It starts with looking after your tamariki. It starts by protecting them and keeping them safe. And while many of our Māori women are homeless, are living in relationships that are not good for them, I think that we need to be able to have the resources to enable our whānau, our Māori women and the tamariki to be safe. And so that's my take-home message. And that safety has to come from home. It starts with yourselves. It starts by looking for your whānau and your family who support you in positive ways. That's my take-home message, because the government ain't going to do it for us. We got to do it for ourselves. So that's my take-home message.
What a bit of tino rangatiratanga from the sister. Who's going? What have you got, Tony? We've still got plenty of time, so you don't need to be short in your final words.
Final words. When we launched our Reitaki, our kind of Mātauranga Māori-based strategy for child health, paediatrician from Lakes District, Danny Delore, said in his kind of final closing comments, we are the health system. And I think that is my reflection to all of us, is that, you know, those of us working within health, we have an opportunity, as Rawiri says, Jean says, to come together and make a difference in the everyday things that we do. If we can make a shift of 1 degree, we're going to end up in a different place. That's the transformative actions we need to make, not big system change necessarily, but in the ways we interact with whānau, in the ways we interact with our colleagues, by continuing to upskill ourselves. I invite people to be activists. I think there's a lot of people who just want the colonisation corridor to go away. I don't really want to deal with Te Tiriti anymore. Do we still have to be talking about equity? We've got a new government now, but healthcare is a human right. Housing is a human right. Child poverty is shameful. And if you don't actively challenge that, you're supporting the continued oppression of Māori children and Māori society as a whole. There was another whakaaro I had. I think co-governance has been revolutionary in our organisation. We now have co-directorships in our child protection unit. We have a co-directorship across nursing. We have co-directorship within our Starship community space. We have co-directorship within our senior leadership team. Having Māori at those tables, having voice, has been revolutionary. So support co-governance, it enables system transformation, it enables us to do, as Jean says, to be building our workforce and having the opportunity to do so. And I had written a quote somewhere from some of our other Indigenous brothers and sisters, because I think they have wisdom for us in our fight for racial justice. And this is from Sitting Bull of the Lakota and Sioux people. And he says, let us put our minds together and see what life we can make for our children. We have an intergenerational obligation to enable our mokopuna their destiny. I think that's kind of, that's kind of it for me.
Beautiful, Tony. Rawiri?
Yeah, that is really helpful, Tony. It's kind of like, if we just take a moment, there's some things that we can look back in our recent history and go, we've made some good progress. And I think it's really important that we notice that. And, you know, you think about the anti-racism movement in Aotearoa is, I don't know, maybe Heather, you need to give us some reflections on this, but it's something like maybe 40 years of work. And I think we should be clear about the successes, that Aotearoa is better off for all of that work, that as a nation and as communities, that's good work with some good results, and we've got much more to do. And so right now, in this moment, we've got some choices to make about what we do. And some of it will be organising more in the tino rangatiratanga space, you know, and Sir Mason Jury said, okay, because actually he's the one who came up with formally the idea of having a Māori Health Authority just about 40 years ago. And yes, it came to pass and it's been knocked over. let's pick ourselves up and keep going. And that might be organising around our whānau, our hapu. It might be organising in terms of iwi space. Great. Tino rangatiratanga stuff. Now's a good time to commit ourselves to that. And there will be other work that we need to do that says we need to live in an environment which is not hostile to us. So we do have to address what's happening in the system. You know, the work that we've done around Te Reo Māori in the last 50, 60 years has been remarkable. And, you know, our reo is, we're hearing it in so many places. It's really important for us to be Māori in our country, to have our reo there. And we've got challenges in the system currently about that. So we do have to work in that space. So challenging the system has to be part of the work that we do now. And I'm just naming sort of two parts of what's a really complex space, but we need to invite everybody because we can tell them sincerely that Aotearoa is a better place when it's anti-racist. So, you know, let's work together, people, and bring that future into reality.
Kia ora. It's beautiful kōrero. Thank you, Rawiri. Thank you, Jean. Thank you, Tony. What we need is relentless, passionate, staunch, articulate advocates for Māori health. And those advocates need to be Māori and they need to be tauiwi. We all need to turn up, get skin in the game and lean in. Thanks to the many organisations that supported this event. You will have seen the special page with all the logos. I want to do a special shout out to all the Māori organisations that have been supporting this event, because often grossly underfunded, and here they are sharing their resources and standing with us on this kaupapa. We're still going. It's a 10-day event. There's more sessions today. There's more sessions tomorrow. There's going to be a beautiful Poroparaaki on Monday night. You can watch the videos on the YouTube channel. It's just the gift that keeps giving. I'm going to close with a special kind of blessing that we use in the core group of Te Tiriti Based Futures. So this is our secret one that we use at the end of every meeting. So thank you to the folk. I am not a liberal snowflake. My feelings aren't fragile. My heart isn't bleeding. I'm a badass believer in human rights. My toughness is in my tenderness. My strength is in the service of others. There's nothing more fierce than formidable, unconditional love. There's not a thing more courageous than compassion, but if my belief in equity, empathy, goodness, and love indeed makes me or people like me snowflakes, then you should know. Winter is coming. Thanks to the tech crew. Lovely to see everybody.
Mauri ora.
Mauri ora. Thank you.